Sources of support include your friends and family, and I see some friends and family it looks like here tonight. Health professionals, support groups, your place of worship. Me and Lori was talking about that earlier. You know, if you have a church group, that's wonderful. If you don't, that's your choice as well too. But a lot of times those are a good support system for you. Asking for support is one way that you take control of your situation. How many of you in this room don't like to ask for help or feel like I don't want to ask one more person to do something for me? When you offer to help somebody, you sincerely want to do something to help them. It can be as little as picking up a newspaper, doing laundry, providing a meal. You truly want to do something to help them. But then in return, when we need that help, we're the same way. We're like, no, I got it under control, when maybe we really don't have it under control. So the best thing you can do for yourself is to go ahead and let that person do something for you. It's going to make them feel good, and it's going to help you recover a lot quicker, and it's going to make you feel good too. And I think those first 6 months, things move so quickly that sometimes it does take 6 months before you realize, what the heck did I just do, and what have I been through? You know, what's my body done? Because things are happening quick. You're seeing the doctor, you're here and you're there, you're not well, you have a good day, a bad day. So you're right about, yeah, that's, yeah, and you probably always will. And that's why it's important to get that support group. And to be honest and open with who you feel comfortable with. And I don't go around, I don't want to wear a billboard or anything that says I'm a survivor or anything like that. But everybody's different on how they share their cancer experience. I guess for me, because I had a hysterectomy, I had surgery, I was done, I felt like I don't experience what some of you may be experiencing with chemo, radiation, and such. So I think as far as that goes, it's up to you as an individual how you want to share your experience, whether you want to or you don't want to. Sources of your support, like I said, include your friends, family, your healthcare professionals, support groups, place of worship, and then of course asking for that support is a way to take control. Because you can't let cancer own you, you have to own it. Easier said than done, believe me. It's way easier said than done. In fact, knowing that you need help is considered a strength. Would any of you thought that's a strength? You felt like that's a weakness, correct? Support groups help people in similar situations share their concerns. Sharing helps members learn coping skills. You gain insights about other cancer treatments. Studies have found that members of support groups have a better quality of life. And the reason that is because you're not carrying that burden. Once you let that out, does anybody journal? Boy, I am a journal nut.
I did a little.
Do ya? My journal, yeah, mine goes clear back to 1983. I have my first journal from 1983.
Well, the only journals I keep are like surgeries and things like, I don't keep a daily journal.
Daily? Well, sometimes I don't journal daily. But do you ever find that when you do journal that it feels good to get that out?
Mm-hmm.
It's kind of like you've told someone, you've released it, but yet you haven't told anyone that's going to go out and tell anyone, right?
Mm-hmm.
And that's the biggest thing I think with sharing cancerous experiences is a lot of people like to keep that to themselves until you're ready to share or pass that on. Remember, a person with cancer is never alone. There are people who care and are ready to help. Some of the best help may be from people who have been there. And I think that's what you're kind of seeing already in this little bit of time we've been together, that there is other people with cancer diagnoses. There's other people who are going through what you're going through. And we have a year out, and it might not seem like a lot, but you that are brand new or 6 months or what can understand where she's coming from. I mean, she's a vibrant, beautiful woman sitting here, and she's doing great. I think that's encouragement. A diagnosis affects more than your health. Like I said, it does affect your finances, health insurance, and your job situation if you're working, if you're an active mom, dad, grandma, grandpa. It takes a toll on every aspect of your life. You might not have the energy you used to have. You might get frustrated easily because you know things that you want to do, but you can't do them because your mind is saying you want to do it, but your body's telling you it's not going to happen. I see a yes right there. Is that a yeah? And that's perfectly normal. And sometimes it does take a while for us to understand that where we may never get back to that, but we might get back to what's considered a good for the situation that we're in, and that's okay. If you need help developing a plan to pay bills, finances, anything at all, even if it's just to finding that right support group or that right connection person, it's okay there again to reach out and say, you know what, I might need some help with that. Because there are people that do care and they do want to help. So, and I think that's the biggest thing, is getting to that point in life where you know that it's okay. You need to find someone, if you're talking finances, who are skilled in that aspect, somebody that's going to be able to help you and give you the best advice, and you want good free advice. You don't want to go to someone that you have to pay, because then that puts more burden of where you're already at. Then if you're having to pay out for that service, then you're really not getting yourself any justice there. There are also specific laws that can help certain people with cancer who are employed. You've got your FMLA, you've got the Americans Disability Act, there's COBRA, HIPAA, because you want to make sure if you are going to be off work, the biggest thing I think some people face is, how am I going to keep my insurance? How am I going to pay my mortgage? How am I going to pay my finances? Don't shed that alone. There are organizations out there, and that's what they specialize in. There's the cancer care group. There's also Patient Advocate Foundation. The Patient Advocate Foundation recently collaborates now with the American Cancer Society. They have trained social worker, financial planners that all free, that you work with from your home, just over the phone, that work with you to help you get through some of those difficult times. They'll even negotiate on your behalf if you want them to help you out with an employer, or say you have a medical bill and you just can't make the payment that person wants you to pay. They'll kind of help you out in that aspect too. And a lot of times I don't think we all know how to find those resources, and then you start to get, myself included, there's times when you just think, oh, forget it. You know, it's just too much work, one more phone call and I'm not going to do it. But I don't want anyone to feel like that. That's why we're here today. I want you to make sure you utilize calling me, calling the toll-free telephone number, get in contact with somebody. And I am a firm believer, if you call in and you don't get the answer you want, let me know, because we can't fix it if we don't know that it's broken. So if you call the American Cancer Society, just as an example is what I'm giving, and you don't get where you want to be, or you didn't get the service that you need, the only way we can fix that is if you let us know, guess what, I called in and it didn't help me. I want to know that so that we can find out what didn't help and what we can find that will help. If you'd like to discuss your cancer experience in a discussion group or chat room, I know a lot of people are internet savvy now. You can get online. There's a lot of online, but when you do, you want to go to a safe site. Not all cancer sites are safe. You know, some people are just going to tell you stuff that you want to hear. Some of the things, and you'll see what I'm talking about here in a minute. If you get on a website, you need to become suspicious if that site's going to tell you they claim of a scientific breakthrough or a miraculous cure. That's what we want to hear, but unfortunately, if that was the case, everybody would have already utilized that. Claims that they can that a product can cure cancer and many illnesses. Claims that a treatment cures cancer but has no side effects. Someone in treatment will tell you that one's not true, won't they? Claims that a product is a secret and only available from one source. Those are sites that if you're on and you see those types of things, you're gonna want to maybe rethink utilizing any of the services or anything on there. And anytime they say a money-back guarantee, unfortunately, I don't think that's the case on a lot of times when you get online and you look for resources. There are types of support that you may need during your different phases of cancer. Someone who's a year out versus brand new versus 6 months, could be 2 years out, it can be 4 years out. Every type of cancer is different. You may have 2 women in here with breast cancer and have 2 totally different experiences, because that's the way cancer is. It's unique to each individual. Asking for support is taking control of your situation. A good place to start building your network is it with your doctor's office, your nurse. Really make sure you build that relationship with your physician and your nurse and that office staff, because you're going to be with them the duration of your treatment. And if you don't have that trust up front, it's going to be a long process. The American Cancer Society, we do have a community of resources. You can actually access them right online. We have a cancer resource center right here in Coshocton County. I don't know if you guys know this, on Main Street, where you can surf the internet. You can pick up any kind of information, literature you want. It's all free. Nobody's going to ask you for anything. You can utilize it. I think the hours vary when we're open over there. But if it's something
open Tuesday and Wednesday.
Yeah, but if there's a day that you would need to get in there, or a time, if you just let us know, I'm sure we can have one of the volunteers meet you there and let you in so that you could get that information. Information on the internet, remember, is not a substitute for your medical provider, okay? Because I know sometimes we all like to think that. I don't know about you guys, but I'm guilty of it. You get a rash or you get a bump or a bruise and you're constantly looking it up to see, what is that? How can I treat that real quick? My granddaughter right now has a rash on the back of her neck. I think it's a heat rash. I found myself, before I even got here, getting on there looking that up, trying to see what it was, and I'm thinking, call the doctor, take her to the doctor, and just get it checked. Like I said, I'm sure it's a heat rash, but I think we all want an answer right now. Nobody wants to wait till tomorrow, right? When you're thinking about something at 2 a.m., you're thinking, I'd really like to know, is this a normal side effect, is it not, and whatnot. We do have through ACS, we have a 24-hour call center, 7 days a week, 365 days a year, where you can call in and get assistance, talk to somebody. There's specialists, insurance specialists. We have oncology nurses. You can ask to speak to a research specialist, things like that. Then, of course, we have the website, and on our website you can get links to other websites that break out into the specialty of your type of cancer.